For 16 years, working in a large community organisation. I was asked quite short notice to do this, and I haven't done anything like this before, so I'm very, very nervous, so apologies if I go on a bit. So the reason I jumped up and said absolutely I will do this is I'm a Labour supporter. Really, it's anything to get the Tories out at this point. We need Labour in, we need a change in the NHS. So from the front line for 16 years, when I started 16 years ago, I had time to care. I had time to sit with my patient and look at everything, not just the physical tasks that I had to do to make them comfortable, actually having time to sit and talk to my patient. Nowadays, if you ask most nurses, we're run ragged all day, every day. And we love our job, we're passionate about it. I wouldn't change it for the world because I want to make my patient's journey as comfortable as possible from birth to death. What I'm seeing at the moment is the cracks. So this has started through slow privatisation, through services becoming a postcode lottery. And on the front line, seeing this actually with the patient, it's heartbreaking. Just all I can think of is an example. So let's say Mr. X. So I go to visit Mr. X for the last 5 years, and Mr. X is looked after his wife at home with vascular dementia. And he's very elderly himself, and he needs care. So Mr. X twice a week would have somebody come and pick him up and take him for a bit of respite, and somebody would watch Mrs. X. So Mrs. X passes away. He has no care anymore. He's on his own. So we go and visit him every now and again when we can to go and look at his leg because he has a bad wound on his leg. As the wound heals, we tell him we're not going to come anymore because there's no nursing need. So Mr. X purposefully disturbs his wound, reopens it, so he can come and have a nurse come to visit us because we're the only one he sees every week. So why does he do this? Well, because the local authority took away his transport that takes him to the day centre, which is his one point of social contact a week. I'm seeing this more and more, day in and day out, and these are the real stories that are happening. Social isolation is really in an increase, and what we don't just need is health input, is social input. Something, Andy, which you brought up in the past, I vehemently, passionately believe, and so do my colleagues, is that health and social care, why can that not be free at the point of contact? It could be sustainable if it's done in a sensible way and money isn't wasted. The social care is... if we give the social care, it is going to help in the long term the health care as well. We need to look at the person as a whole, not just the health, because where there's poor social care, poor mental health services, eventually that will become physical and they'll have physical needs as well. It's the whole package. And we're not treating people as humans, we're treating them as tick boxes. And as nurses, I'm compassionate to care, I want to care, and I'm not being given the tools to do it. Those tools are being taken away from me. It's intensely frustrating, and we need support. And we're certainly not getting that from the Tories, who are giving us quite a lot of spin and quite a lot of rubbish. And I won't say what we say about them at the office, because I'll probably get in trouble. But we need a change. And I don't know, as a nurse, what more I can sort of campaign out there as to, it's real people, I'm seeing it day in and day out, and they need people's support, they need your help.